I'm now joined by Angus Forbes, Chair of the Stream on Education and Integrated Care. Angus, thank you so much for being with us today.
Pleasure, yeah, thank you.
So first of all, tell us about some of the issues that the Stream is going to be focusing on this year.
Well, our main thrust is really obviously looking at education, but also integration of care, which I think is a common experience problem that people with diabetes have, in the sense that their care isn't always joined up, and the messages and support that they need to be effectively self-managing can get very confusing for them, and often they don't always access the kinds of education and input that they might need to help them achieve that. So in the programme I think we've got quite a broad range of topics, but some highlights I guess are an interest in e-health and m-health initiatives. Now these are reflecting the changing culture of life generally, I guess, with people using more things like social media and electronic gadgets to support their daily living. The other thing is looking at different generational needs, and I think this is the other thing about education with diabetes, is the sense that people are always changing and they have different needs at different points in time, and unfortunately the system doesn't always recognise this. So in our programme we've got some really interesting stuff on older people. The prevalence of diabetes in the older population is much greater than it is in the general population, and I guess another group within the sort of age spectrum are children and young people, and I'm very pleased that we've got a very exciting programme looking at preventing diabetes in children and adolescents, and I think this is a very important area. The programme of work in diabetes to help promote young people to be more active I think is a very key area, and again that's been an exciting part of the programme. We're also looking at different other transitions that occur through time, so that diabetes is not a static entity, so that if you've got diabetes at any given moment in time you might have good strategies for coping and dealing with it. Those things change and the system needs to reflect that.
How important is self-management in people living with diabetes, and what developments are we seeing in assisting people who are doing this?
Personally, I think that self-management is the most important dimension of diabetes care, and I don't just say that because I have a self-interest in self-management. I say that because at the end of the day, I mean, we can invent technologies and we can invent new therapies which can help ameliorate the effect of the disease, and in some cases we have got approaches which can help reverse the disease. We've got dietary interventions which can actually stop diabetes and reverse it. We're experimenting in our team with very low calorie diets, for instance, and we're having very good results of this. But at the end of the day, the person who has to do these things is the patient. Consistently in different surveys around the world that we've seen, the amount of educational support that are given to patients can be very variable. So I think it's an ongoing area where we cannot afford to be complacent. I think it's absolutely essential that if we're going to get good value out of technologies and innovations to treat and manage diabetes, then alongside that we have to develop the processes of self-management to ensure that those therapies have good impact on the population.
Where are we in terms of informing and educating people about diabetes?
The problem of diabetes is now a huge global concern. It's a growing concern. There is not a corner of the globe that isn't affected by it one way or another, and I think unfortunately again from global surveys that have recently been conducted, it would seem that we're still a long way off actually having consistent resources and information to the population as a whole and within the healthcare system in terms of managing those things. And it's also important to think about the connectivity between provisions. So for instance, if you have diabetes, you have multiple other problems, or you may have general health issues. I don't think we're doing enough really to promote the awareness of diabetes, both at the individual level, but also in terms of the community and population levels, and how that reflects in how we evolve our society and the industries within those societies to actually gear us towards away from diabetes rather than our sort of constant march in the direction of more and more diabetes, because that is not a sustainable future.
Angus, great to talk to you on this. Thank you very much for sparing the time.
Thank you very much. Very well. Very pleased to do so.